Hi, my name is Edna and I'm going to answer the 6 questions for Simulations Debriefing Guide. Question number 1 and 2. Tell me where you saw caring exhibited in the scenario, and tell me what behaviors you observed that were not caring behaviors. So after seeing the whole video, all I can see is the nurse is rushing the discharge stitching. She wanted to get all the things done right away without assessing if the patient is going to have help after discharge and if she understood the teaching on how to take care of her baby. Maybe I can say the caring part is when the nurse talked to her colleague about the patient's situation. She seems concerned and named all the problems, however, she did not do anything about it. Also, the nurse did not respect the patient. We need to maintain patient privacy by at least knocking on the door before coming in, but she did not do it. When she asked the patient who will take care at home, the nurse do not let the patient finish answering. She ignored the most important information when the patient said, I do not have home. She could refer the patient to social services or to case manager. Placing baby between mother's leg is not a good location to do teaching. The nurse also did not use gloves when changing diaper. After her teaching, she did not assess the patient understanding by teach back method. She knows that the patient did not seem involved with the teaching. She should have investigate to find out what the deeper problem is. Because of this, the baby's life is in danger. We don't know if the baby can get the care he or she will need from her mother. Question number 3 and 4. How would you respond in this situation? Tell me about the priorities in this scenario from the patient's viewpoint and from nurse's viewpoint. In this situation, the patient teaching is not effective. She did not assess how much knowledge the patient acquired during the teaching. Discharge teaching is crucial for continuity of health care. When teaching is not effective, health is at risk, and most of all in these situations, baby's life is at risk. Patient seems to ask more about the pain medication rather about her care for her baby. Since the patient is still young, she may not understand how much responsibility she has in taking care of her baby. Or maybe she's still in denial and trying to cover up all of her worries by changing the subject when the nurse asked her if she understood the teaching, and she answered her back by saying how cute her baby is. There must be a lot of things in her mind, such as where to go after discharge, where she can get basic needs for both of them, who she can ask for help her taking care of her baby, and these are too much for the teenager to handle. This is why we are here to help her and guide her more on how to take care of our baby and refer her to the other professionals. I currently work in orthopedic floor. We make sure that teaching is done properly. Discharge teaching is vital to improve health outcomes of the patient. If the patient did not understand how to take care of their wound, the importance of hand washing and keeping the dressing clean, dry, and intact, infections is more likely to occur. That being said, this infection can be ignored by the patient because he or she did not know what are the signs and symptoms and when to call the doctor until it is too late. Because again, the discharge stitching was not correctly done. Infection can lead to sepsis, which can turn into septic shock, and people die from it. Question number 5. Tell me about resources that could be offered for this patient. There are several places where a patient can be referred to live with her baby at no cost. Some of them are Lighthouse Youth for Family Services and the Covenant House. Also, I can refer the patient to Chesapeake Social Services, and they are the right people where they can help her where to go, and they can check both patient and the baby for the follow-up to see if they're doing okay. Question number 6. How would you transfer what you learn here to the practice setting? Nurse-patient trust relationship is very important in nursing practice. To build trust, nurse must have to be compassionate. According to the article Cultivating Compassionate care is a relational activity that is about the way in which we relate to other human beings when they are vulnerable. It involves noticing another person's vulnerability, experiencing an emotional reaction to this, and acting in some way with the person in a way that is meaningful for people. Also, nurse must show respect, openness, consistency, honesty, a good listener, and keeping their promises. Once the trust is built up, this can make the patient to open up more and communicate more with a nurse. Having trust makes the teaching more effective, which improves patient health outcomes. If I was the nurse, I would assess her knowledge after teaching by teach-back method, and I will let her practice on changing diaper in front of me. I would refer her to the case manager and to social services. Also, the other problem here is staffing. This problem that majority of the institutions have. With enough staffing, nurse will not have to juggle that much with all of her tasks she has. The nurse will have enough time to spend with the patient and the patient will not feel being rushed. I have learned that even though we are busy, we have to make sure that the discharge teaching is effective and assess patient understanding and be a good listener. Also, establishing trusting relationship with the patient and also with the family members is an essential part of the effective communication, which is crucial to the delivery of high quality and efficient care. Thank you.